Have you ever felt like your body is changing in ways you never expected? As we age, our bodies undergo numerous transformations, some visible and others deeply personal. If you've noticed changes in your sexual health or physical appearance that leave you feeling uncertain or concerned, you're not alone. In this video, we'll explore the common transformations that occur with aging, particularly focusing on men's sexual health. By watching until the end, you'll gain valuable insights into understanding these changes, learn about effective strategies to manage them, and discover ways to maintain your confidence and well-being. Whether you're seeking solutions, reassurance, or simply want to stay informed, this comprehensive guide is designed to support you every step of the way. Don't miss out on empowering yourself with the knowledge to embrace aging gracefully and maintain a fulfilling quality of life. If you are not subscribed, I recommend subscribing and activating the notification bell so you don't miss any videos. Your support means a lot to me, and if you enjoyed this video, you can help me continue spreading the valuable lessons by liking and sharing it. First change: excess skin. As we journey through life, the body naturally undergoes many changes, some of which can be quite surprising, particularly as we enter our 70s and beyond. One of these unexpected transformations is the appearance of excess skin on the penis, a change that many men may not anticipate. This phenomenon is largely due to the body's gradual decline in the production of collagen and elastin, the two proteins responsible for keeping skin firm, youthful, and resilient. Over time, the loss of these essential components leads to a decrease in the skin's elasticity, causing it to become looser and less toned. For many men, this transformation can be emotionally jarring, as the once taut, firm skin of their penis begins to show areas that are sagging or drooping. The physical appearance of this excess skin can be alarming, leading some men to believe they're experiencing a condition like phimosis, where the foreskin does not fully retract over the glands of the penis. However, in most cases, this is simply a normal part of the aging process rather than a medical condition. What men often mistake for a new onset of phimosis is simply the skin's natural loss of elasticity, which creates the illusion of more skin than before. This shift, while visually significant, doesn't necessarily signal a problem, but rather reflects the body's natural evolution as it ages. Beyond the changes in the skin of the penis, this loss of elasticity is something men might observe in other parts of their bodies as well, such as their face, neck, and hands. These are areas that have long been associated with signs of youth, as they are often firm and taut during younger years. With time, however, even these areas begin to soften and sag as collagen production slows and gravity exerts its pull. In particular, the penis, which is typically under a certain degree of natural tension, loses that firmness, becoming looser and more pliable. This can be especially noticeable because the penis is not only a deeply personal part of the body, but also one closely tied to self-image and masculinity. For many men, seeing these changes can provoke a range of emotions, from shock to concern and even embarrassment. It's easy to feel a sense of loss or worry that this shift signifies a decline in one's sexual vitality. But it's essential to remember that these changes, while aesthetic, do not interfere with sexual function. The ability to achieve and maintain erections is not affected by the looser skin, and for most men, sexual performance remains unchanged. What does change, however, is the need for more attentive care in terms of hygiene. With the skin being looser, there may be an increased risk of irritation or discomfort, particularly if proper care isn't taken to keep the area clean and dry. If you are still watching this video and find these lessons useful, please comment 1 below to let me know that you are still here with me. Even though this transformation is a natural part of growing older, it's understandable that some men may feel uncomfortable or self-conscious about the change. Fortunately, there are options for those who seek to address these cosmetic concerns. Various treatments, such as skin creams designed to boost collagen production and improve elasticity, can help to restore some of the lost firmness. Additionally, dermatological procedures are available for men who prefer a more proactive approach to managing the appearance of excess skin. These treatments can provide a sense of control over the aging process, helping men feel more confident and comfortable in their bodies. However, it's important to note that many men find peace in embracing this aspect of aging. There is a certain strength in accepting the natural changes that come with growing older, understanding that the body's transformation is a reflection of a life well lived. For those who choose to accept these changes rather than resist them, this acceptance can foster a sense of inner peace and emotional resilience. The recognition that aging is a universal experience, one that touches every person in different ways, can be liberating. Rather than viewing these changes as losses, they can be seen as reminders of the body's incredible capacity to adapt and evolve. Moreover, this journey through aging can open the door to deeper conversations about intimacy, connection, and the evolving nature of sexual relationships. As men navigate these changes, they may find that their relationships with their partners also evolve in meaningful ways. Physical intimacy may take on new forms, with a greater emphasis on emotional connection, tenderness, and mutual understanding. This can be a time for rediscovery of oneself, one's partner, and the unique ways in which intimacy can be experienced in later life. For many couples, these years can bring a renewed sense of closeness, where the focus shifts from physical appearance to emotional depth, shared experiences, and lasting affection. For those seeking guidance on how to navigate these physical and emotional shifts, there is an abundance of resources available. One such resource is my digital book, Rediscovering Intimacy: Healthy Sexuality After 60 Years. This book offers practical advice and uplifting insights for men and couples who want to rekindle the passion in their relationships, while addressing the emotional and physical challenges that may arise with age. In it, you will find effective solutions for maintaining a satisfying and fulfilling sexual life, despite the natural changes that occur in the body over time. The book covers everything from managing the physical transformations of aging to reigniting the emotional spark in a long-term relationship. It's designed to provide encouragement, support, and practical tips for embracing intimacy at every stage of life. In the end, aging is a journey that affects every part of the body, including those we hold most private and personal. The appearance of excess skin on the penis, like other signs of aging, is a reminder that time changes us all, but these changes do not define us. By understanding and embracing the natural transformations that occur as we grow older, men can continue to lead fulfilling, confident lives. Whether through treatments that restore elasticity or through acceptance of the aging process, the choice is deeply personal and should be guided by what makes each feel comfortable and at peace with their body. Aging is a chapter in life's rich story, one that comes with its lessons, growth, and opportunities for deeper self-awareness. Second change: loss of elasticity. As the years pass, the body will inevitably experience a series of profound and sometimes unexpected transformations. One of the most significant changes, particularly in the penis, is the gradual loss of elasticity. This shift is primarily driven by the body's decreasing production of collagen and elastin, two critical proteins that provide the skin with its firmness, flexibility, and ability to stretch. Over time, the natural reduction of these substances directly impacts the skin's capacity to stretch and contract, which, in the case of the penis, can result in noticeable differences in both appearance and sensation during an erection. In youth, the skin of the penis stretches seamlessly, creating a firm, taut appearance during arousal. But as the years go by and collagen and elastin levels diminish, the skin's ability to stretch diminishes as well. Consequently, the penis may no longer appear as firm or as tightly stretched during an erection, changes that can be both visibly and physically apparent. This loss of elasticity doesn't only affect the outer skin. The internal fibers within the erectile tissue also experience similar changes. As these fibers lose their flexibility, the penis may not achieve the same degree of rigidity that it once did during an erection. Although men can still achieve and maintain erections, the firmness they experience may be noticeably reduced, creating a sensation of less overall tightness. This can lead to concern, frustration, or discomfort for many men who are adjusting to the realities of aging. What was once familiar and predictable about their body's response to sexual arousal may begin to feel different. causing some men to feel a loss of control over their sexual function. Additionally, this reduction in elasticity can have an impact on how the penis responds to sexual stimulation. With less flexible skin and tissues, the erection may not feel as vigorous as it did in earlier years, and the penile response to stimulation may seem somewhat muted or less intense. This change is often gradual, but it can still be emotionally challenging for many men who associate the firmness and responsiveness of their penis with their sexual vitality and masculinity. Even though these changes are a normal part of the aging process, they can trigger feelings of insecurity or a diminished sense of self-confidence in intimate situations. Beyond the effects on erections, the loss of elasticity also impacts the appearance of the penis when it is at rest. The skin may appear looser, and the overall look of the penis may not be as streamlined or firm as it was in youth. These changes can further contribute to feelings of unease or discomfort, especially for men who were once accustomed to a more toned, youthful appearance. The penis, like many other parts of the body, simply looks and feels different as it ages, which can be unsettling for men who are grappling with this aspect of the aging process. While the loss of elasticity is a natural and unavoidable change, it's important to remember that it does not signify the end of sexual function or the ability to enjoy a fulfilling sex life. The capacity to achieve and maintain an erection remains intact, even if the erection doesn't feel quite as rigid or firm as it once did. For many men, this knowledge can provide some reassurance as they navigate the physical changes of aging. However, for those who find the shift distressing, there are treatments available that can help improve skin elasticity and potentially enhance the firmness of the penis. These treatments may include specialized creams designed to boost collagen production or therapies that target the restoration of elasticity in the skin and tissues. Some men may also benefit from adopting lifestyle changes that support overall skin health, such as staying hydrated, eating a balanced diet rich in nutrients that promote collagen production, and engaging in regular physical activity that improves circulation. While these measures may not reverse the effects of aging, they can contribute to a sense of well-being and help men feel more proactive in maintaining their health and appearance. However, it is important to acknowledge that many men choose to accept these changes as a natural part of growing older, recognizing that the body evolves in countless ways throughout life. For these men, the acceptance of the loss of elasticity in the penis and other parts of the body can lead to a deeper sense of peace and self-compassion. Rather than viewing these changes as losses, they can be seen as reminders of the body's resilience and ability to adapt over time. This shift in perspective can help men cultivate a greater sense of confidence and contentment, knowing that the aging process is something that unites all of us. Furthermore, the changes in the body's physical appearance and function as we age can serve as an opportunity to explore new dimensions of intimacy and connection. As the body transforms, so too can how men experience pleasure, intimacy, and affection with their partners. With the loss of some physical elasticity may come a gain in emotional intimacy, as men and their partners find new ways to connect on deeper, more meaningful levels. Physical intimacy may shift from a focus on performance to an emphasis on emotional closeness, communication, and shared experiences, allowing couples to grow even closer as they age together. For those who are interested in exploring how to navigate these changes in a positive and empowering way, there are resources available to guide and support this journey. One such resource is my digital book, Rediscovering Intimacy: Healthy Sexuality After 60 Years. This book offers practical advice and encouraging insights for men and couples who are seeking to maintain a fulfilling sexual relationship despite the natural changes that occur with age. From addressing physical challenges to fostering emotional connection, this book provides the tools and inspiration needed to keep passion and intimacy alive in the later years of life. Ultimately, the loss of elasticity in the penis is just one part of the broader experience of aging. While it may bring new challenges, it also opens the door to growth, acceptance, and deeper connections with ourselves and our loved ones. By embracing these changes with openness and self-compassion, men can continue to lead fulfilling and satisfying lives, both physically and emotionally. Aging is not the end of vitality, but rather a new chapter in the journey of life. One that is filled with opportunities for continued growth, exploration, and love. Third transformation, decrease in size and girth. As men age, it is not uncommon to notice a gradual decrease in both the size and girth of the penis, a change that can be emotionally unsettling for many. This transformation, while natural, can be attributed to a variety of factors related to aging, most notably the decline in vascularization, which plays a crucial role in maintaining erectile function. Over time, the efficiency of blood circulation to the penis diminishes, leading to a reduction in both the length and thickness of the organ during erection. The arteries responsible for carrying blood to the penis can undergo structural changes, including narrowing due to the accumulation of atherosclerotic deposits. This narrowing reduces blood flow, meaning that less blood reaches the penis during sexual arousal. As a result, the volume of blood necessary to achieve a fully engorged erection is reduced, creating the perception of a smaller size and a less full girth. One of the key changes contributing to this phenomenon lies in the erectile tissues of the penis, known as the corpora cavernosa. These tissues are responsible for filling with blood during an erection, leading to the firmness and size men experience in their youth. However, as the aging process progresses, the corpora cavernosa may not expand as efficiently as they once did. The reduced blood flow causes these tissues to fill less completely, leading to a decrease in the overall firmness, thickness, and diameter of the penis during an erection. This can lead to feelings of self-consciousness or concern, as men struggle to reconcile the changes in their bodies with their past experiences. It is important to understand that this reduction in size and girth is a natural consequence of aging and does not necessarily indicate a serious underlying health problem. Many men find this change disconcerting, especially as it can impact their confidence and self-image. However, it is crucial to remember that these changes are a normal part of the aging process, and while they may affect the aesthetics of the penis, they do not mean the end of a fulfilling sexual life. The ability to achieve and maintain an erection remains intact for most men, although the firmness and size may feel different than in younger years. For men who are concerned about the decrease in size and girth, several strategies can help mitigate its effects and improve overall vascular health. A key factor in maintaining adequate blood flow to the penis is cardiovascular health, which directly influences erectile function. Adopting healthy lifestyle habits can significantly improve circulation and, by extension, help maintain better erectile function. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can promote cardiovascular health and support better blood flow throughout the body, including to the penis. Foods high in antioxidants, such as berries, nuts, and leafy greens, can help combat the oxidative stress that contributes to vascular aging, while omega-3 fatty acids, found in fish and flaxseed, can promote heart health and reduce inflammation in the blood vessels. Regular physical exercise, especially aerobic activities like walking, running, swimming, or cycling, can also play a critical role in maintaining healthy blood flow and preventing further declines in erectile function. Exercise helps to stimulate the cardiovascular system, ensuring that the arteries remain flexible and that blood continues to flow efficiently to all parts of the body, including the penis. Strength training exercises can also be beneficial, as they help to improve circulation and boost overall vitality. Additionally, practices like yoga and stretching can enhance flexibility and promote relaxation, further supporting cardiovascular health. Avoiding harmful habits like smoking and excessive alcohol consumption is equally important in preserving vascular health. Both smoking and alcohol are known to contribute to poor circulation, which can exacerbate the effects of aging on penis size and erectile function. Smoking, in particular, has a well-documented negative impact on blood vessels, leading to the narrowing of arteries and reducing blood flow to the penis. Quitting smoking can significantly improve circulation and help slow the progression of age-related changes in the penis. Similarly, reducing alcohol intake can support better vascular function and overall health, as excessive drinking is associated with poor blood flow and an increased risk of erectile dysfunction. While the physical changes brought about by aging can feel challenging, it is essential to recognize that they are a normal part of life. Many men choose to embrace these transformations as an opportunity to focus on their overall well-being and explore new ways to experience intimacy. Sexuality in later life does not have to be defined by the same physical standards as in youth. Instead, it can evolve into something richer, with a greater emphasis on emotional connection, mutual satisfaction, and deeper intimacy. For many couples, this stage of life presents an opportunity to redefine what it means to be intimate, finding joy in the closeness and affection that comes with long-term relationships. If you are still watching this video and find these lessons useful, please comment below to let me know that you are still here with me. For those who feel uncomfortable or distressed by the changes in their body, there are also medical treatments available that can help address concerns about size and firmness. Various therapies, such as medications that improve blood flow or devices that enhance erectile function, can offer solutions for men looking to regain some of the firmness they've lost. Consulting a healthcare provider can help men explore these options and determine the best course of action based on their individual needs. Ultimately, while the decrease in size and girth can be a difficult change to accept, it does not define a man's ability to enjoy a fulfilling and satisfying sex life. By focusing on overall health, improving circulation, and maintaining a positive outlook, men can continue to lead vibrant and rewarding lives, both physically and emotionally. Aging is a natural process that brings with it both challenges and opportunities for growth. By embracing these changes with a sense of openness and resilience, men can navigate the stage of life with confidence and grace, knowing that their worth and vitality extend far beyond physical appearances. Fourth transformation, buried penis. As the body progresses through the natural stages of aging, many men notice significant changes in the appearance of their penis, one of which is a phenomenon known as buried penis. This transformation is often distressing, as it can lead to the penis appearing smaller or less visible, creating feelings of discomfort or self-consciousness. The buried penis effect is primarily caused by two factors that are common with age: the accumulation of fat in the pubic region and the sagging of the scrotum. Over time, the fat in the lower abdomen and pubis tends to build up, forming a layer that obscures part of the penis, making it appear shorter and more recessed. This change is often most noticeable when the penis is at rest, as the surrounding fat in the pubic area causes the penis to appear more submerged than before. This effect can be particularly unsettling for men, as the penis may seem as though it is receding into the body. For some, it may create the impression that the penis has shrunk in size, even though the actual length of the organ has not changed. The visual impact of the surrounding fat often leads to the perception of a diminished penis, which can affect a man's confidence and body image. In addition to the accumulation of fat, another factor contributing to this effect is the natural sagging of the scrotum, which becomes more pronounced with age. Normally, the scrotum holds the testicles in a firmer, more elevated position. However, as the years pass, the skin and connective tissue of the scrotum lose their elasticity and tone, causing the scrotum to loosen and hang lower. This sagging can further contribute to the buried penis effect, as the lower hanging scrotum can make the penis appear more recessed about the surrounding fat. This combination of pubic fat and scrotal sagging can lead to a significant change in the overall appearance of the genital area, a transformation that many men find distressing. The once prominent appearance of the penis may now seem overshadowed by the changes in the surrounding anatomy, leading to feelings of embarrassment or dissatisfaction with one's body. These physical changes can also have emotional repercussions, as men may feel that their masculinity or sexual vitality is being called into question by these visible signs of aging. For men who feel uncomfortable or disheartened by this change, there are solutions available to address the buried penis effect and restore confidence. One of the most common corrective options is cosmetic surgery, specifically liposuction of the pubic region. This procedure involves the removal of excess fat from the lower abdomen and pubic area, helping to restore the penis's visibility by reducing the layer of fat that surrounds it. Liposuction can significantly improve the aesthetic appearance of the genital region, giving the penis a more prominent and visible appearance. For men who feel that their buried penis has negatively impacted their body image or self-esteem, this procedure can offer a sense of renewed confidence and comfort in their skin. In addition to liposuction, other surgical and non-surgical treatments can help address scrotal sagging. Procedures aimed at toning and tightening the skin of the scrotum can lift and support the testicles, reducing the looseness that often accompanies aging. These treatments can include minimally invasive techniques that stimulate collagen production and improve the elasticity of the skin, providing a more natural and youthful appearance to the scrotum. For men who prefer to avoid surgery, there are also non-surgical therapies that focus on strengthening the underlying tissues and enhancing skin firmness, which can help mitigate the appearance of scrotal sagging and contribute to a more balanced and proportionate look. While cosmetic procedures can be effective for men seeking to correct the buried penis effect, it's also important to recognize that lifestyle changes can play a role in reducing the accumulation of pubic fat and promoting overall health. Maintaining a healthy weight through proper diet and regular exercise can help prevent excess fat from accumulating in the pubic area. Cardiovascular exercises, in particular, can improve overall body fat distribution, while strength training can tone muscles and support healthy skin elasticity. For men who are experiencing the buried penis effect primarily due to weight gain in the pubic region, adopting a more active lifestyle and focusing on healthy eating habits may reduce the severity of this aesthetic concern. For those who feel that the psychological and emotional impact of these changes is affecting their quality of life, it's important to have open discussions with healthcare professionals. Seeking advice from a doctor or specialist in men's health can provide clarity and guidance on the most appropriate treatment options, whether surgical or non-surgical. Additionally, addressing concerns early on can help men feel empowered to take control of their health and appearance, rather than feeling helpless as the effects of aging progress. It's important to remember that while the buried penis effect may be disheartening, it is a natural part of the aging process for many men. The changes in body composition, skin elasticity, and fat distribution are normal and affect various parts of the body, not just the genital region. However, these changes do not define one's masculinity or worth, and there are effective solutions for those who wish to improve their appearance and regain a sense of comfort and confidence in their body. Many men choose to embrace these changes as part of the journey of aging, while others may seek out treatments to address their concerns. Both approaches are valid, and each man's experience of aging is unique. Fifth transformation, penile calcification. Penile calcification is a condition that can develop as men age, often linked to underlying medical issues such as Peyronie's disease. This condition becomes more common in older men and is characterized by the formation of fibrous tissue plaques within the corpora cavernosa, the structures in the penis responsible for erection. In Peyronie's disease, these plaques arise due to a chronic inflammatory response, leading to the deposition of calcium and scar tissue within the penis. Over time, this process results in hardened, rigid areas that disrupt the normal function and appearance of the penis. The plaques can cause the penis to develop a noticeable curvature, which may vary in severity, and can make sexual relations uncomfortable or, in some cases, even painful. The impact of penile calcification goes beyond just the physical appearance of the penis. The hardened plaques within the corpora cavernosa limit the penis's ability to expand properly during an erection. Normally, during arousal, the corpora cavernosa fills with blood, allowing the penis to become firm and straight. However, when calcified plaques are present, this expansion is restricted, leading to deformities that make it difficult to achieve a complete and satisfactory erection. As a result, men may experience significant discomfort, not only in terms of sexual performance, but also in self-confidence and emotional well-being. The curvature caused by Peyronie's disease and penile calcification can range from mild to severe. In more extreme cases, the curvature may become so pronounced that it interferes with sexual intercourse, creating both physical pain and psychological distress. The emotional toll of these changes can be profound, as many men feel a deep sense of frustration or embarrassment about their condition. The altered appearance and function of the penis can affect a man's self-image and his relationship with his partner, leading to a decline in sexual satisfaction and intimacy. In addition to Peyronie's disease, other factors can contribute to penile calcification. Repeated trauma to the genital area, such as injuries sustained during intense sexual activities, sports, or other physical activities, can lead to the formation of scar tissue. These microtraumas accumulate over time, and as the body attempts to heal, calcified plaques may form as part of the scar tissue response. These injuries, even if minor at the time, can have a lasting impact on the health of the penile tissue, ultimately contributing to the development of calcification and curvature. Given the complexity and discomfort associated with penile calcification, it is crucial for men experiencing this condition to seek medical attention. Early intervention can help manage symptoms and prevent further complications. Treatment options vary depending on the severity of the calcification and the degree of curvature. In mild cases, non-surgical treatments may be recommended. These can include medications designed to reduce inflammation, improve tissue flexibility, and slow the progression of plaque formation. Oral treatments or injectable therapies may be used to soften the plaques and restore some of the lost elasticity to the penile tissue. In more advanced cases where the calcification has caused a significant curvature or where non-surgical treatments have proven ineffective, surgical intervention may be required. Surgery can involve the removal of the calcified plaques to correct the curvature and restore the penis to a more functional state. In some cases, grafting procedures are necessary to replace the damaged tissue with more flexible, healthy tissue. These surgeries, while invasive, can provide significant relief for men who are struggling with the physical and emotional burden of Peyronie's disease and penile calcification. For many men, the decision to pursue surgery is a difficult one, influenced by the severity of their symptoms and their comfort with the idea of undergoing a medical procedure. However, for those who are experiencing significant pain, discomfort, or difficulty with sexual activity, surgery can be a life-changing solution, offering a chance to regain confidence and sexual function. In addition to medical treatments, lifestyle adjustments can also play a role in managing the condition and preventing further trauma to the genital area. Men who engage in high-intensity sports or activities that put them at risk for injury should take precautions to protect themselves. This could include wearing protective gear or avoiding activities that pose a high risk of impact or strain on the genital region. Taking care to avoid unnecessary trauma can help prevent the development or worsening of calcification over time. For men living with penile calcification, maintaining open communication with a healthcare provider is essential. Urologists and specialists in men's health can provide valuable guidance on the best treatment options based on the individual's condition and lifestyle. Moreover, seeking support early on can help alleviate some of the emotional stress that often accompanies this condition. Many men feel isolated or embarrassed about their symptoms, but it is important to recognize that penile calcification is a medical issue like any other, and there is no shame in seeking help. If you are still watching this video and find these lessons useful, please comment 3 below to let me know that you are still here with me. While the idea of living with penile calcification can be daunting, it is important to remember that solutions are available. Whether through non-surgical treatments, lifestyle changes, or surgical interventions, men can take steps to manage their condition and improve their quality of life. The journey may be challenging, but with the right support and treatment, it is possible to regain both physical function and emotional confidence. 6. Transformation. Loss of lubrication. As men age, one of the subtle yet significant changes they may notice is a loss of natural lubrication in the penis, leading to increased dryness and discomfort. This transformation is closely linked to the body's decreasing ability to produce moisture, particularly from sebaceous glands, which are responsible for secreting oils like sebum that help keep the skin soft, flexible, and well hydrated. Over time, as these glands produce less oil and the skin's ability to retain water diminishes, the penis can become drier and more prone to irritation. The reduction in the skin's natural hydration is particularly noticeable during sexual activity, where the lack of lubrication can cause heightened friction, making intercourse less pleasurable and, in some cases even painful. The drying of the penis skin is part of the broader process of aging, where the skin throughout the body loses elasticity and moisture. Just as the skin on the face, hands, and other areas becomes more prone to dryness and wrinkling with age, the skin of the penis undergoes similar changes. The diminished production of natural oils and moisture-retaining substances makes the skin less supple, leading to an increase in roughness and sensitivity. For men, this loss of lubrication can be particularly disconcerting, as it directly impacts the comfort and pleasure associated with sexual activity. Without sufficient lubrication, sexual activity can lead to uncomfortable friction, making intercourse less enjoyable for both partners. In severe cases, the dryness can cause irritation or small lesions on the skin, further complicating intimacy and adding to the emotional strain that often accompanies such physical changes. The loss of lubrication can also interfere with the quality of erections. Normally, during arousal, the skin of the penis stretches and expands along with the erectile tissues, facilitating smooth movements and enhancing the overall sexual experience. However, when the skin is dry and less flexible, it can create a feeling of rigidity or tightness, making erection and movement during intercourse feel uncomfortable or even restrictive. This discomfort can reduce the effectiveness of sexual movements, making the experience less satisfying. The natural glide that comes with well-hydrated skin diminishes, and instead, there is increased resistance, which can detract from the spontaneity and ease of sexual interaction. For men, this can lead to frustration or even anxiety about their sexual performance, as the once natural and pleasurable act of intimacy now feels hindered by the body's physical changes. Moreover, this lack of lubrication can contribute to psychological distress, as men may feel their bodies are failing them in a key aspect of their personal and relational lives. Fortunately, there are effective solutions to mitigate these effects and restore comfort during sexual activity. One of the most accessible and helpful remedies is the use of external lubricants. Water-based lubricants are particularly beneficial because they are gentle on sensitive skin and provide a temporary solution to the lack of natural moisture. These lubricants help reduce friction during intercourse, offering a smoother, more comfortable experience. They not only alleviate the physical discomfort, but also restore some of the sensuality and ease that may have been lost due to dryness. Water-based lubricants are often preferred for their compatibility with the body's natural chemistry, and they are less likely to irritate oil-based or silicone-based alternatives. In addition to using lubricants during sexual activity, incorporating specific moisturizing products designed for the genital area into a daily skincare routine can also make a significant difference. Moisturizing creams that are formulated to restore the skin's moisture barrier can help reduce dryness and improve the skin's overall texture and flexibility. It's essential to choose hypoallergenic, fragrance-free products that are gentle enough for sensitive skin to avoid any further irritation or discomfort. Regular application of these moisturizers can help maintain skin hydration, making the penis skin softer and more resilient over time. For men experiencing significant dryness, it may also be helpful to consider the role that overall health and lifestyle play in maintaining skin hydration. Staying hydrated by drinking plenty of water, eating a balanced diet rich in healthy fats and nutrients that support skin health, and avoiding substances that can exacerbate dryness, like alcohol and tobacco, can all contribute to improved skin quality. Additionally, certain medications or health conditions, such as diabetes or hormonal imbalances, can affect skin moisture levels. So it's important to consult with a healthcare professional if dryness is particularly severe or persistent. Beyond the physical discomfort, it's important to acknowledge the emotional and relational impact that these changes can have. Many men find it difficult to discuss issues of dryness or discomfort with their partners, fearing embarrassment or a loss of intimacy. However, open communication is key to maintaining a healthy sexual relationship during this stage of life. Discussing the use of lubricants or other measures to improve comfort can help remove any stigma or discomfort associated with these changes. It's also important to recognize that these adjustments are a natural part of aging and do not diminish a man's worth or his ability to enjoy a fulfilling sexual relationship. Seventh transformation, skin spots. As we grow older, the skin of the penis, much like the skin on other parts of the body, can begin to show visible signs of aging, including the appearance of spots and color changes. These skin spots are a natural consequence of aging and are generally harmless, reflecting changes in the skin's underlying structure and function. As the years go by, the skin's ability to regenerate and maintain a uniform, youthful appearance diminishes. The decrease in the production of essential proteins like collagen and elastin, which provide the skin with elasticity and support, plays a significant role in this transformation. With the gradual loss of these structural components, the skin becomes more susceptible to the development of both hyperpigmented dark and hypopigmented light spots. Dark spots, or hyperpigmentation, often arise due to an accumulation of melanin, the pigment responsible for giving skin its color. Over time, the skin's ability to regulate melanin distribution becomes less efficient, resulting in the formation of isolated areas where melanin is either overproduced or underproduced. While these dark spots can appear anywhere on the body, they may also show up on the penis, even though it is not typically exposed to the sun. On the other hand, lighter areas or hypopigmentation can occur when the skin loses its pigment altogether, leading to uneven coloration. Though the skin of the penis is generally shielded from direct sunlight, internal factors like hormonal changes, reduced blood circulation, and the natural aging process can still contribute to the formation of these spots. Environmental factors, such as prolonged exposure to pollution and the use of certain chemicals or irritating products, may also play a role in accelerating the appearance of these blemishes. The skin becomes more fragile as we age, and its ability to recover from these external aggressors weakens, leading to the development of imperfections. In most cases, these skin spots are benign and do not pose any serious health risks. They are simply an aesthetic consequence of aging. However, it's important to remain vigilant about changes in the skin. Men should monitor their skin regularly for any new spots or changes in existing ones, particularly if the spots are accompanied by unusual symptoms such as itching, pain, or changes in size, shape, or color. Rapid changes in the appearance of skin spots could be an indication of more serious conditions, such as infections or dermatological diseases, which may require medical evaluation. One example of a condition that may cause dark spots on the penis is post-inflammatory hyperpigmentation, which can occur after trauma or irritation to the skin. This could result from something as simple as friction during sexual activity or the use of harsh soaps or skincare products. In some cases, infections like fungal or bacterial infections can also lead to changes in the skin's pigmentation. While these spots are often temporary and fade over time, medical treatment may be required if an infection is the underlying cause. Another condition that may present with spots or discoloration is lichen sclerosis, a chronic skin disorder that causes white patches to form on the genital skin. While the exact cause of lichen sclerosis is unknown, it is thought to be related to hormonal changes or an overactive immune response. This condition can cause discomfort and itching and may require medical treatment to manage the symptoms and prevent further skin damage. For men who are concerned about the appearance of spots on their penis, some steps can be taken to manage these changes and maintain healthy skin. Regular skin care practices, such as using moisturizers that support skin hydration and integrity, can help prevent excessive dryness, which can exacerbate the appearance of spots. Opting for products that are specifically designed for sensitive skin, particularly those without harsh chemicals or fragrances, can also help protect the skin from further irritation and discoloration. In addition to moisturizing, it is important to avoid products that could irritate the skin or contribute to inflammation. For example, using gentle, hypoallergenic cleansers rather than harsh soaps can help maintain the skin's natural moisture barrier and prevent unnecessary irritation. It's also advisable to avoid excessive friction, whether from tight clothing, prolonged physical activity, or sexual activity, without adequate lubrication. Reducing friction can help minimize the risk of irritation and the formation of post-inflammatory hyperpigmentation. While topical treatments can help with mild discoloration, more pronounced cases of hyperpigmentation or hypopigmentation may benefit from dermatological interventions. For instance, certain creams containing ingredients like hydroquinone, retinoids, or vitamin C can help lighten dark spots and improve overall skin tone. On the other hand, if hypopigmented areas are a concern, treatments that encourage skin regeneration and increased cell turnover may be beneficial. Consulting a healthcare professional or dermatologist is the best way to determine the appropriate course of action based on the specific nature of the spots. In some cases, more advanced treatments, such as laser therapy or microdermabrasion, may be recommended to treat stubborn pigmentation issues. These treatments target the pigmented areas to break down excess melanin or stimulate new skin cell growth, helping to restore a more uniform skin tone. However, these procedures are typically reserved for more severe cases and should be performed under the supervision of a trained professional. 8. Change fissures. As men age, one of the more uncomfortable and concerning changes that can occur is the development of fissures on the penis skin. These small cracks or splits in the skin surface are directly linked to the increasing dryness and loss of elasticity that often accompanies aging. Over time, the skin's ability to retain moisture diminishes, primarily due to a reduction in the production of sebum and other natural hydrating substances that keep the skin soft, flexible, and resilient. This lack of moisture leads to dry, fragile skin that becomes more susceptible to damage. In particular, the penis, which may experience frequent friction during sexual activity, becomes more vulnerable to the formation of fissures. These fissures often present as tiny lines or cracks on the surface of the skin, which may appear almost invisible but can cause significant discomfort or even sharp pain, especially during erections or sexual activity. When the skin stretches during an erection, the already fragile and dry tissue can crack, leading to painful fissures that disrupt sexual function and overall well-being. The friction associated with sexual activity can exacerbate the problem, causing the skin to break more easily and leading to increased irritation and sensitivity. The presence of fissures can profoundly affect a man's sexual health, reducing the pleasure of intimacy and replacing it with discomfort or pain. For many men, these small but painful lesions can cause them to shy away from sexual activity or to feel anxious about their sexual performance. Beyond the physical discomfort, the emotional toll can be significant, as the fear of experiencing pain or worsening the fissures can create anxiety around sexual encounters. This, in turn, can impact relationships, as partners may struggle to navigate the balance between maintaining intimacy and avoiding discomfort. In addition to the direct pain and discomfort associated with fissures, these cracks in the skin pose a greater risk of infection. When the skin is compromised by fissures, it loses its natural protective barrier, allowing bacteria and other pathogens to enter more easily. This can lead to infections which may present as redness, swelling, discharge, or a worsening of the fissures themselves. The risk of infection is especially high in areas where moisture and heat are present, such as the genital region, as these conditions provide an ideal environment for bacterial growth. Infections not only add to the discomfort, but can also lead to more serious complications that require medical treatment. Addressing fissures and preventing their recurrence requires consistent care and attention to skin health. The first line of defense is regular moisturizing to restore lost hydration and improve the skin's elasticity. Using gentle, hypoallergenic moisturizers that are free from fragrances and harsh chemicals can help keep the skin soft and supple, reducing the likelihood of fissures forming. These moisturizers work by locking in moisture and helping to rebuild the skin's natural barrier, making it more resilient to the friction and stretching that occurs during sexual activity. It's also important to avoid harsh soaps, detergents, or other skin care products that can strip the skin of its natural oils, leading to further dryness and irritation. Opting for gentle cleansers that are formulated for sensitive skin can help maintain the skin's natural moisture balance and prevent additional damage. Avoiding prolonged exposure to hot water, which can dry out the skin, is another simple but effective way to protect against fissures. For men who are already experiencing fissures, particularly if they are painful or appear to be infected. Seeking medical advice is crucial. A healthcare provider can assess the severity of the fissures and recommend appropriate treatments. In some cases, a prescription cream may be necessary to reduce inflammation, promote healing, or fight off infection. Medical attention is especially important if the fissures are accompanied by symptoms such as intense pain, swelling, or discharge, as these could indicate a more serious infection that requires intervention. In severe cases, where repeated fissures occur or where the skin's dryness is extreme, a dermatologist may recommend treatments that help to restore the skin's natural moisture barrier and improve elasticity over time. This might include the use of prescription moisturizers, barrier creams, or other therapies designed to enhance skin health and prevent further cracking. In addition to using moisturizers and avoiding irritants, men can take steps to prevent fissures by ensuring proper lubrication during sexual activity. Dry skin is far more susceptible to damage, and using a high-quality lubricant can help reduce friction and protect the skin from the stress of stretching and movement. Water-based lubricants are often the best choice, as they are gentle on the skin and do not disrupt the skin's natural moisture balance. Silicone-based lubricants can also be effective, as they tend to last longer and provide a smoother glide, reducing the risk of irritation. Hydration also plays a key role in maintaining skin health. Staying properly hydrated by drinking plenty of water helps to keep the skin moisturized from the inside out. Eating a balanced diet rich in essential fatty acids, vitamins, and minerals that promote skin health, such as omega-3 fatty acids, vitamin E, and zinc, can also help to support the skin's natural moisture retention and elasticity. If you are still watching this video and find these lessons useful, please comment below to let me know that you are still here with me. Ultimately, while fissures can be a painful and frustrating consequence of aging, they are a condition that can be managed with the right care and attention. By focusing on keeping the skin moisturized, avoiding irritants, and seeking medical treatment when necessary, men can reduce the likelihood of fissures forming and prevent infections from occurring. With the proper skincare routine and lifestyle adjustments, it is possible to maintain healthy, comfortable skin and enjoy an active, fulfilling sexual life well into the later stages of life. 9th change, penis shortening. Penis shortening is a noticeable change that can occur with aging, driven by several interrelated factors that accumulate over the years. One of the primary reasons for this phenomenon is a decrease in vascularization in the genital area. As men age, the blood vessels that supply the penis may narrow or become less efficient, which reduces the amount of blood that reaches the penis during arousal. This reduction in blood flow impacts the penis's ability to achieve and maintain a full erection, making it appear smaller than it did in earlier years. This effect can be particularly disconcerting, as men may feel that their penis no longer looks or performs the way it once did. In addition to diminished blood flow, the accumulation of fat in the pubic region plays a significant role in the perception of penis shortening. With age, it is common for men to gain weight, particularly around the midsection and lower abdomen. The buildup of fat in the pubic area, also known as the suprapubic fat pad, can push the penis inward, reducing its exposure and making it appear shorter. This effect is often more pronounced in individuals who have experienced significant weight gain over the years. Even though the actual length of the penis has not changed, the increased fat around the base can give the illusion that the penis is smaller or partially buried, which can affect a man's self-confidence and body image. Changes in the tissue structure of the penis also contribute to this perception of shortening. Over time, the elastic tissues that surround the penis lose some of their volume and firmness. This is a natural part of the aging process and reflects how the body's tissues degrade and repair more slowly as we grow older. As the penile tissue loses its youthful elasticity, the penis may appear less voluminous, even when fully erect. These changes in tissue composition, combined with a reduced blood flow and accumulation of fat, create the impression of a shorter, less robust penis. While these changes are a natural part of aging, they can be distressing for many men, particularly those who have associated their sense of masculinity and sexual identity with the appearance and performance of their penis. The emotional impact of this perceived shortening can lead to anxiety about sexual performance, diminished self-esteem, and even relationship strain. However, it is important to understand that these changes are common and that there are ways to mitigate their effects and preserve genital health. One of the most effective ways to combat the appearance of penis shortening is by maintaining a healthy weight. Reducing the accumulation of fat in the pubic region through a balanced diet and regular exercise can help ensure that the penis is more fully exposed. Minimizing the buried effect caused by excess fat. Cardiovascular exercises, in particular, help improve overall circulation, ensuring that the blood vessels remain healthy and capable of delivering adequate blood flow to the penis. This can lead to improved erectile function and may help men maintain a more satisfying erection, both in terms of size and firmness. Strengthening the pelvic floor muscles is another important strategy for preserving erectile function and mitigating the effects of penis shortening. The pelvic floor muscles play a key role in supporting the bladder, bowel, and sexual organs, and exercises that target these muscles, often called Kegel exercises, can help enhance blood flow to the genital area and improve control over erections. By engaging in regular pelvic floor exercises, men can improve the firmness of their erections and reduce the likelihood of penis shortening over time. These exercises are simple to perform and can be incorporated into a daily routine with minimal effort, providing long-term benefits for sexual health and function. In addition to physical exercise, paying attention to overall health and wellness is crucial for maintaining genital health as men age. Ensuring that the body receives the proper nutrients, staying hydrated, and managing stress levels can all have a positive impact on blood circulation and tissue health. Men should also consider limiting their intake of alcohol and quitting smoking, as both of these habits are known to constrict blood vessels and reduce circulation, further exacerbating the issue of penis shortening. For men who are experiencing significant distress over the perceived shortening of their penis, there are also medical interventions available. In cases where excess fat in the pubic region is a major contributing factor, liposuction of the suprapubic area can help remove the fat and expose more of the penis, restoring a more natural appearance. Additionally, treatments such as shockwave therapy or injections designed to stimulate blood flow and collagen production in the penile tissue may help restore some of the lost volume and elasticity, improving both the appearance and function of the penis. It is also important to remember that open communication with a healthcare provider can help address any concerns related to penis shortening. A urologist or men's health specialist can provide guidance on the most appropriate treatments and lifestyle adjustments based on an individual's unique situation. By taking proactive steps to manage weight, improve circulation, and strengthen the pelvic floor muscles, men can significantly reduce the impact of age-related changes and continue to enjoy a healthy and satisfying sexual life. 10th change, decreased sensitivity. Decreased sensitivity in the penis is a common and often distressing change that many men experience as they age. This loss of sensation can be especially pronounced in older adults who suffer from chronic health conditions such as hypertension and diabetes, both of which have a direct impact on nerve function and blood circulation. These conditions affect the body in ways that can reduce the penis's ability to respond to sexual stimuli, resulting in diminished sexual sensitivity and pleasure. Hypertension or high blood pressure is known to damage blood vessels over time. This damage reduces the efficiency of blood flow, including the flow of blood to the genital area. Adequate blood circulation is critical for both achieving and maintaining an erection and for the penis's sensitivity to stimuli. When blood flow is compromised, as it often is with hypertension, the penis may not respond as readily or as fully to sexual stimulation, leading to a decrease in overall sensitivity and sexual performance. Diabetes, particularly when poorly managed, can lead to a condition known as diabetic neuropathy, where elevated blood sugar levels damage the nerves throughout the body. The nerves in the penis are no exception, and diabetic neuropathy can cause a significant reduction in sensation in this area. This nerve damage means that even when a man is sexually stimulated, the signals between the brain and the penis may be weakened, leading to a muted or incomplete sensory response. As a result, Men with diabetes often find it more difficult to feel the same level of pleasure or satisfaction from sexual activity. The consequences of decreased sensitivity are far-reaching, as they can diminish not only sexual pleasure, but also overall sexual performance. Men may find it harder to become aroused or maintain an erection, which can, in turn, affect their confidence and emotional well-being. The loss of sensitivity may make sex feel less enjoyable, and over time, this can impact the quality of intimate relationships. For many men, these changes can lead to feelings of frustration, anxiety, or even depression as they grapple with the reality that their bodies are no longer responding in the ways they once did. Despite the challenges posed by reduced sensitivity, there are ways to address and manage this change. The first and most critical step is to focus on the management of underlying health conditions, such as hypertension and diabetes. Keeping these conditions well controlled through medication, lifestyle changes, and regular medical checkups can help minimize their negative effects on nerve function and blood flow. In the case of diabetes, maintaining healthy blood sugar levels is crucial in preventing further nerve damage and preserving sexual sensitivity. In addition to managing chronic health conditions, several strategies can help improve sensitivity and sexual function. Consulting a healthcare professional is important, as they can provide specific treatments and recommendations tailored to the individual's needs. Physical therapies that focus on improving circulation and nerve health, such as pelvic floor exercises, Kegels, can help strengthen the muscles involved in sexual function and enhance blood flow to the genital area. These exercises are simple to perform and, with regular practice, can lead to noticeable improvements in sexual sensitivity and performance. Medications are another option for men seeking to improve sensitivity and erectile function. In some cases, doctors may prescribe medications that enhance blood flow to the penis, such as phosphodiesterase inhibitors, commonly known as erectile dysfunction medications like Viagra or Cialis. These medications work by increasing blood flow to the penis, which can improve both the quality of erections and the sensation experienced during sexual activity. If you are still watching this video and find these lessons useful, please comment 5 below to let me know that you are still here with me. For men who are experiencing more severe sensitivity loss, aesthetic procedures or medical interventions aimed at penis rejuvenation are also becoming more popular. Treatments such as platelet-rich plasma, PRP, therapy, or shockwave therapy are designed to stimulate tissue regeneration and improve blood flow, potentially restoring some of the lost sensitivity and enhancing overall sexual performance. These therapies are often performed in a clinical setting and may require multiple sessions for optimal results. However, they offer hope for men who are looking for more intensive solutions to the challenges posed by aging. In addition to medical and therapeutic options, lifestyle changes can have a profound impact on maintaining and improving sexual sensitivity. Regular physical activity helps to improve cardiovascular health, which in turn supports better blood circulation throughout the body, including to the genital area. Exercise also releases endorphins and reduces stress, both of which play a role in improving sexual health and overall well-being. Activities that increase flexibility and reduce tension, such as yoga or swimming, can also promote better circulation and nerve function. A balanced diet rich in nutrients that support nerve health and circulation is equally important. Foods high in antioxidants, healthy fats, and vitamins like B12, which are known to support nerve function, can help protect against nerve damage that contributes to decreased sensitivity. Omega-3 fatty acids, found in fish like salmon and mackerel, can also promote healthy blood flow, while foods like dark leafy greens, nuts, and seeds provide the essential nutrients needed to maintain tissue health. Effective stress management is another key factor in preserving sexual sensitivity. Chronic stress can exacerbate the effects of aging on the body, leading to increased blood pressure, poor circulation, and further reductions in sexual sensitivity. Finding healthy ways to manage stress, whether through meditation, mindfulness practices, or hobbies that promote relaxation, can have a positive impact on both mental and physical health. Men who are proactive in managing stress are more likely to experience better sexual function and overall quality of life. It is also important to foster open communication with a partner about any changes in sexual sensitivity. Many men feel embarrassed or anxious about discussing these changes, but having an honest conversation with a partner can help reduce the emotional burden and ensure that both partners are on the same page. Partners can explore different ways to maintain intimacy and pleasure, even if the physical sensations have changed. Sometimes, focusing on emotional connection and other forms of physical affection can enhance intimacy and alleviate some of the stress associated with decreased sensitivity. We've covered a lot of important changes that occur with aging, from penis shortening to decreased sensitivity, and how they impact not just physical health, but emotional well-being as well. Now, we'd love to hear from you. What have you learned so far? Share in the comments one thing that stood out to you and something you'll bring into practice in your life moving forward. If you like this video, please leave your comment below. And don't forget to like, share, and subscribe to our YouTube channel for more insightful content on health, aging, and well-being. Thank you for watching.